Let's talk about painless local anesthetic in the maxillary arch when we're anesthetizing maxillary teeth. How can you give an injection that's so fantastic that the patient does not feel a thing? They will love you if you use this anesthetic technique. Now we're going to talk about a mandibular injection on another Dental Minute video. Today we're going to be focusing on the painless maxillary injection of local anesthetic. Step 1, dry the tissue and place topical ointment. Now this is an excellent topical anesthetic gel combination. Lidocaine 100 milligrams mixed with prilocaine 100 milligrams and tetracaine 100 milligrams. And you can have this mixed in a compounding pharmacy. It's very effective. So dry the tissue and place this first with a 2x2 in the back of the mouth so it doesn't drain down the patient's throat and they think that they can't breathe. They really can, but they'll feel like they can't breathe because their throat's numb. Now this needs to sit on the tissue for about a minute to be effective. Then I'm going to spray the tissue with Hurricane topical anesthetic spray. This is 20% benzocaine. Again, there's a 2x2 in the back of the mouth. Now I'm blowing this in with my air syringe. I'm blowing it into the tissue. This is an incredible local anesthetic method. Your patients will love you because they won't feel a thing. Then, these are the 3 types of anesthesia, local anesthesia, that I utilize. 4% sit-nest plain with no vasoconstrictor, lidocaine 2%, 1 to 100,000 epinephrine. Now don't use lidocaine 2%, 1 to 50,000 epinephrine. There's too much epinephrine and it can give a patient heart palpitation. So except in rare instances, don't use the 1 to 50, use the 1 to 100,000 epinephrine. And then if you need a long-lasting anesthetic, say you're doing surgery or have a long appointment, you can use Marcaine 0.5%, 1 to 200,000 epinephrine. Now, Marcaine will keep the mandible anesthetized for about 12 hours and the maxilla for about 4 to 5 hours. So if you have a long appointment, it's very effective. I always start with sit-nest plain because it is pH neutral. This is about the pH of the body. So we start with that because there's no sting. I'm using a 30 gauge short needle. I'm turning the bevel of the needle toward the bone. And I put a tiny bend in the needle just so I know the bevel is on this side. Then, right at the coronal part of the unattached gingiva, don't give the injection in attached gingiva, give it in unattached. I'm going to barely go under the tissue and just tap the end of the syringe and express some of the sit-nest plain. Then I'll go a little bit further, tap it again, a little bit further, tap it again, but keep it against the bone, against the alveolar process. Don't let it go out here into the tissue or it won't get to the teeth. You want to keep it right on the bone and it'll just slide right in, and go ahead and slide it in all the way to the end of the needle. Then we'll come back and do the same thing here, just barely go under the tissue and just tap the end of the syringe where you express just a little bit of the sit-nest. The patient won't even feel it, and then you can go a little bit further. Same thing here, but always inject on the facial into the unattached, non-keratinized tissue. And I'm just slowly same thing, just barely under the tissue, tap it, and then you can go a little further, tap it, a little further, tap it. And so the sit nest, which is pH neutral, is going to anesthetize the tissue. Then we're going to come back with the lidocaine and anesthetize the teeth. Now you can either use a long 27 gauge needle, or you can continue with the 30 gauge short. Again, I've bent this needle so that it shows me that the bevel is toward the tissue. And I'm going to slide that along the bone all the way to the end of the needle, and that will anesthetize the superior alveolar nerve. You'll also get some anesthesia of the greater palatine nerve on the palate. Then I'm going to come back with I'm going to use the 30 gauge short for the bicuspids and the anterior teeth. Again, the bevel is toward the bone. Now with the lidocaine, I don't have to go so slowly. I usually do, just because sometimes the tissue expansion can be a little bit uncomfortable. But that tissue's already been anesthetized with the sit nest 4% plain, which was pH neutral. Now the lidocaine and the marcaine are not pH neutral, so if you start with those, it will sting, even with the topical. Okay, following anesthesia on the facial side, spray the palate with the Hurricane topical spray. Now this is an intrasulcular injection. This is critical if you're doing anything of consequence on people that aren't elderly. Once they're elderly, the nerve has changed and it's not so close to the surface, it's shrunk, and there's not so much sensitivity. But if you're doing it on a young person or a middle-aged person, it's imperative that you give an intrasulcular injection or the tooth will not be numb, period, most of the time. If you're doing endodontics and extraction, a crown prep, you must give an intrasulcular injection, and you always do that with sit nest plain. If you do it with lidocaine or something with vasoconstrictor in it, you'll get an ulcer, which is not the end of the world, but it takes 2 weeks to go away, and that'll be the only thing the patient remembers about that procedure. So use the sit nest plain after you've sprayed the topical on the palate. Then I'm going to blow that in again, blow it into the sulcus. Then I'm going to come again with the 30 gauge short needle, slightly bent so the bevel is to the tooth. Now this is the critical part of this injection. Remember, the sit nest plain is pH neutral, so you don't have a sting if you don't sting the patient with the needle itself. So what I do is barely put that needle into the sulcus and tap into the gingival sulcus and tap the end of the syringe. And keep tapping until it makes contact with the tissue very lightly, and then continue to tap. And finally, you can put more pressure on the tissue and just slowly increase the pressure right in, and the objective is you're injecting it into the periodontal ligament around the tooth. So it's imperative that that bevel is toward the tooth, and you determine that by slightly bending the needle, not a lot, just a little, and you know that the bevel is on the bent side. So this is a painless injection. The patient will not feel this even though it's on the palate. And after a while, you can actually make this tissue blanch and the patient won't feel it. But it's and then, since we've got some implants right here, I can inject right here because this tissue, or the greater palatine nerve in this area, has been anesthetized from the intrasulcular injections with the sit nest plain. So I can inject here just straight into the palatal tissue without pain.